Everyone has a mountain to climb, and autism has not been my mountain. It has been my opportunity for victory. Dr. Carrie Magro.
Join me as we jump into the Autism Navigation Pod. Yeah, and I know the autism diagnostic process sometimes can be lengthy. Would you mind sharing your experience just around finding someone who can do an autism evaluation, what it looked like before, if you had to fill out any questionnaires or meet with anybody before Trip met with the evaluator?
Yeah, absolutely. So one of the things that was the biggest frustration to us is that because I researched a lot, and the biggest frustration was everybody said that early intervention was the most important thing. And when we started to try to get a diagnosis, there was just waiting lists everywhere. So I was like, okay, how do we get early intervention if we can't even get a diagnosis for 6 months to a year? I mean, that's what they were telling us, 6 months to a year to even get a diagnosis. The early intervention program that we had him in are the ones that gave us several different places that we could go to get diagnosis. And I put him on a waiting list for 3 or 4 different places that all would take our insurance because it's super expensive to get the diagnosis if you can't run it through your insurance, which was another factor in it. Not that we wouldn't pay the money, but why go extensively into debt if you can get the insurance to do it?
Did you have any trouble getting insurance to cover it?
They covered the diagnosis, but after that, they wouldn't cover treatment of it. So that was the frustrating part, is that they would cover getting a diagnosis, but then they were like, you're on your own. We were on 3 or 4 different waiting lists, and I only had 2 places that sent me questionnaires before that we got, a time that we were going to do it. So I filled out the questionnaires for both of the places, and they were pretty extensive questionnaires. And it's kind of hard because they want to know all these milestones, and you can't remember. Your child's a little older, he's almost 3, and I can't remember when he, did all those milestones. And part of that issue that I have with that is because my son and daughter are only 13 months apart. And so you're like, which one did that milestone then? Or, you know what I mean? It kind of meshed together. And so, but it was a lot of questions. And the nice thing for me that made it a little easier too was we had done the early intervention program. And so we had already filled out a lot of that information with them. And so I did have it in my mind when he hit those milestones or did not, because a lot of it was he had not hit those milestones.
I'm so excited to introduce another great guest, Dr. Allison Womack. She's a registered psychological associate. She's got her bachelor's from the University of Victoria, her master's from the University of the Pacific, and she's got her PhD in school psychology from Syracuse University. She's a board certified behavior analyst at the doctoral level, and she's currently with Bridges of the Mind Psychological Services Incorporated. She's got specialties in autism, ADHD, intellectual disability, and learning disability assessments. She's got 20 years of experience working with individuals diagnosed with autism spectrum disorder and developmental disabilities. She's worked in homes, schools, behavior clinics, community-based programs, anywhere where people need her. She's co-authored 8 peer-reviewed publications She developed and implemented research projects leading to over 30 regional and international conference posters and presentations. And for 6 years, she served as the clinical director of ABA services across various sized mental health clinics in Sacramento. Through psychological assessment, Dr. Womack values helping parents better understand and really support their child. She also enjoys helping young adults understand themselves and live happier, more meaningful lives. She also provides evidence based recommendations to support continued individual growth and understanding. And just as importantly, in her free time, and it doesn't sound like there's a lot of it, Dr. Womack enjoys spending time outdoors with her husband, her 2 kids, and her dog. Dr. Womack, thanks so much for coming on today and talking to us about preparation for autism evaluations. I think it's so helpful for our families just to know what to expect.
Yeah, absolutely. It's my pleasure. I appreciate the opportunity to be here.
Yeah, thank you. So what do caregivers, family members, parents, what do they need to know? They've made the decision to get an autism evaluation. What do they need to know before they do that?
Yeah, that's a great question. And I'll kind of preface that by saying that, there might be some slight variations to what I'm talking about today. So this is kind of how we do our autism assessments here at Bridges of the Mind Psychological Services, but there might be some slight variations regarding the process, depending on where parents are going for their ASD evaluations. So I would recommend at the outset, when parents are scheduling their assessments for their child, talking to the facility where they're scheduling to see what their process is like, just getting some more clarification. Because again, there might be some slight variations with what I'm talking about today. So it's always great to be able to ask your specific facility what parents can expect when they're going there. But in general, for us, parents can typically expect to complete some initial questionnaires regarding their child. And these questionnaires, they can be pretty lengthy. There's a lot of questions, and really we're trying to gather information about their child's overall level of functioning in the home. So what parents are seeing that their child can do, and the things that they're struggling to be able to do as well. And that'll look at many different areas. So it'll be looking at their child's adaptive functioning, at their communication, any behaviors they might be seeing at home. So there'll be a lot of different areas that'll be covered in those questionnaires. And the questionnaires that will be delivered, again, will depend on their child's age. So some of the questionnaires are geared more towards younger children, whereas there are some older, or some questionnaires that are geared more towards older children as well. So again, it'll really depend on their child's age as to which specific questionnaires they're getting. But overall, we're trying to get a better idea as to what parents are seeing at home and where some of their child's strengths are and where weaknesses might be.
It sounds really like a lot of information, and it makes sense. The diagnosis for autism is very complex. How much time? I know it's got to be a huge range, but how much time do you think parents should maybe plan to carve out to complete these assessments or the questionnaires?
Yeah, so to complete the questionnaires ahead of time, I think it really depends on parents and how quickly they can go through them. I would say to at least give yourselves at least 30 minutes, maybe an hour, to make sure that you're really able to read through the questions in detail and read through the instructions, make sure you're understanding everything before answering the questions. And some parents really prefer to do it together. So if it's a 2-parent household, going through the questions together and maybe talking about what each parent is seeing to be able to give a better overall impression of their child. So I would say to at least give yourselves 30 minutes to an hour. And again, it's going to depend on the specific questionnaires that are being sent to the parents to complete ahead of time.
Awesome. So with these questionnaires, you mentioned that they're going to measure adaptive functioning, behaviors, all of that. How does that inform the evaluator, how does that prepare the evaluator to complete an accurate, useful evaluation?
Yeah, yeah, it gives us a better idea overall as to where the child's level of functioning might be before they come into the assessment. Some practitioners, these assessments are done in person with them, so it's not necessarily that we need to have these questionnaires completed ahead of time, but sometimes it is beneficial to have them done prior to the assessment. But it just gives us a better idea overall as to where the child's strengths and weaknesses are. Some of the questionnaires are more geared specifically towards autism, so they're more autism related questionnaires. So it gives us an idea as to where some of those autism related behaviors are being ranked, or what parents are seeing at home, so we can follow up on those items during our initial intake interview with families.
Awesome. And I think that all makes sense. As we know, as practitioners and as professionals, questionnaires can be, very subjective, by definition. So do you have any recommendations for like when families or parents or other caregivers should complete these questionnaires? In other words, like should they wait, like if it's been a really difficult week, for example, and maybe behaviors have escalated, should they wait to complete the questionnaire, or maybe like review the questionnaire? Or how would you advise a family to kind of navigate a situation like that?
Yeah, that's a really good question. I would make sure that parents are doing it as much as possible when they have the time, when they're not feeling pressed or pressured to complete it within a specific time frame, when their heads are as clear as possible. That's a lot easier said than done, especially if you do have a child with special needs. So as much as possible, trying to give themselves adequate time and headspace to be able to do it in that time frame. Sometimes the questionnaires, the instructions may be difficult to understand. Parents may not be understanding what is being asked of them. And I would just say, if that's the case, if you're not understanding what's being asked to do after reading through the instructions, then typically I would say to hold off, reach out to the office and say, I'm not understanding this. I don't know what I'm supposed to do. In those kinds of situations, typically we'll tell parents that's okay. We'll do it with you when you come in. We'll be better able to explain some of the questions and walk you through it. So if you're not understanding the questions or not understanding what to do, I would just say to hold off until you are able to meet with your psychologist or diagnostician to go through those questions with them. So you're not just guessing or doing the best that you can, but so that you're able to provide that invaluable information.
Yeah, I'm so glad you brought that up, because it can be weird to say, like, I don't understand a question that's, written in English. And I think that a lot of times it can just like feel like embarrassing to say, like, I don't know what this question is asking. But a lot of times I feel like I've seen they're written in ways that, are maybe more meant for, professionals like yourself. And so I'm glad you brought it up. So it's it's okay to ask for clarification, I think, from your psychologist or whomever the evaluator is.
Yeah.
So I do really appreciate that for our families.
Yeah. They're not easy. It does take time. I look at them and I think about my own children when I'm going through and trying to answer the questions, and it's hard. You think, well, sometimes my child does this, but not all the time. So it's hard not to overthink the questions too as you're going through it. So just kind of taking that into consideration as well.
How much weight do these questionnaires have on the outcome of an evaluation?
It's definitely part of the assessment, but we're looking at there are lots of different puzzle pieces. So the questionnaires are one puzzle piece, but we're looking at the child globally. So part of the assessment, when parents will come in for the assessment for their child, typically you'll start with an intake interview. So your assessor will be asking a lot of questions. A lot of these questions you might have already answered within the questionnaires, but we're going to follow up and ask very specific, detailed questions about, their child's developmental milestones, when they first learned to sit and crawl and walk, when their speech started developing, when they said their first words, when they started combining words. We're going to be asking questions about their understanding of language, how they're able to follow directions, their verbal language abilities at this time. So, what can they say expressively? How did they get their wants and needs met? What their social interactions and relationships are like, any behaviors that parents might be seeing at home, looking at, are we having huge tantrum problem behaviors? Are we seeing aggressive behaviors? Are we seeing self-injurious behaviors? Any kinds of repetitive motor movements? Really getting all that information from the parent during that initial intake interview. So that's part of the assessment process. And then typically the assessor is going to work directly with the child as well. So we're going to be looking at their specific social and communication skills with us in the office, as well as any restrictive or repetitive patterns of behaviors that we might be seeing as well. So the assessment process, takes all of those different pieces into consideration when we're looking at the diagnostic criteria for autism to see if that child meets criteria for a diagnosis of autism.
It sounds very comprehensive.
Very much so. Yeah.
So it's the day of the evaluation, and all the questionnaires are filled out, completed to the extent that families are able to, and the diagnostician or evaluator is going to spend time with the child. How can parents or caregivers kind of like prepare their child for the evaluation that they're about to receive?
Yeah, that's a great question. I think one of the biggest things I would recommend, again, is just kind of getting information from the specific facility that parents are taking their child to. Again, the process might be slightly different depending on where they're taking their child to what I'm talking about today. But I would make sure to get the information from the specific facility as to what they can expect when they go there, so that parents are really aware of what the process will look like for them. And parents, they know their children best. So I think parents know best how to prepare their child. Some children need that advanced warning or those proactive strategies to know what's going to happen that day. And some children don't need that and would do better just the day of. So I think parents know their children best to be able to know how to prepare their child. But if parents know what to expect, I think that they can make that decision as to what they're going to tell their child or how they're going to communicate what the day will be like.
And what maybe would that look like? Our parents usually like in the room for an evaluation. We're probably bleeding into episode 3 a little bit, so maybe we'll do a spoiler or a cliffhanger. But what can families kind of like, if they are preparing their child for this evaluation, and the child's old enough to like really understand to some degree, what types of things should they be like telling them about the evaluation? Will they be like one-to-one? Will parents be in the corner? How does that all work in general?
Yeah, and that process will depend on the child's age and their level of functioning a little bit as well. But typically there's an intake interview with parents. That's how we start our assessments here, is just kind of gathering all that information from what parents are seeing. Depending on the child's age again and their level of functioning, sometimes the children are in the room with us for that intake interview. And sometimes they're not. Sometimes they're in a separate room playing or doing other things before they come in and meet with the assessor. And that's, again, kind of just dependent on the child's level and then parent preference as well. Sometimes parents don't want to have these discussions about their child's behaviors or their difficulties or challenges directly in front of their child. So sometimes the children will be waiting, sometimes they're in the room with us, and then they will typically be working one-on-one with the assessor. If it's a younger child, Typically, parents remain in the room while the assessor is working directly with their child, and so they can be sitting back. Typically, they're at the back of the room watching, but they may be asked to engage with their child a little bit as well. If it's an older child, typically the parent steps out of the room while the assessor works directly with their child, looking at these social and communication behaviors and restrictive interests that are associated with the diagnosis of autism. The assessors may also be doing some cognitive testing while the child's there, just getting an idea as to their strengths and weaknesses in terms of intellectual functioning.
Great. I think it's so helpful. I know so many kids with autism just struggle with things that are different, change to routines, and this obviously would be well outside, a daily routine. So I think just being able to prepare them and having parents listen to this and just have a better understanding of how to talk to their child about it is hopefully going to be invaluable and really improve experiences for so many different kids that are being evaluated for autism.
Yeah, absolutely.
Awesome. So thank you so much for spending a part of your day talking about this. Again, I just think it's so helpful for parents. Is there anything else that maybe we didn't cover or that would be helpful for parents to know before we let you go?
Oh, that's a great question. I mean, I think that we've done a great job covering kind of just those general initial expectations of what parents can expect. Again, just making sure that they talk to where they're going, so they have a better indication as to what those specifics will be regarding the practitioner they're going to go see.
Perfect. Dr. Womack, thank you so much for joining us. I think it's so helpful for families. I just am so impressed with all of your experience and education and just the work that you've done to improve lives across the board. I think it's really impressive. I also just really appreciate how personable and generous you are with your time. I know that our families are going to feel the same way.
Oh, thank you so much. It's been my absolute pleasure. I have such a love and passion for assessments and for people on the autism spectrum. They're some of my absolute favorite people in the world, and I just love what I do. So I love being able to share some of this initial process with everyone.
Can you talk a little bit about what that evaluation process was like for you?
Yeah, so we were recommended to the company we went to by a couple of people, primarily my sister. And so we scheduled the appointment. That was a few months out, at least. I think it was like 3 or 4 months out to get him in for the testing. And I remember there was a lot of pre-paperwork, pre-appointment paperwork. We had to have answered like 1,000 questions at least. And many of them seem to cover the same thing over and over again. I'm sure that's the way they're designed. And it was just kind of, I remember going through the questions and thinking some of them were obviously not geared specifically to small children. And so, we'd answer in certain ways, but I remember asking the questions and we'd go, oh yeah, that's Jareth. Oh, that's Jareth, and that's Jareth. And over and over again. So we filled that out, and then the day came. We went in, and I remember going in with him into the room to do the actual testing with the person at the company, and I remember being told, try not to interact, try to just be here. We need to have good baselines. And so I did my best to just sit and be quiet and observe, unless he requested something specifically from me, or if I was prompted to, I would redirect. But I think one of the big things for the person testing him, there was a bucket of things that she had there, and she would unlock the bucket and get something out, and then she put the lid back on. He would go over and lock the bucket. And she noticed that every time that he unlocked it, or she left it unlocked, he locked it. So she kept unlocking it at random times. As soon as he saw that it was unlocked, He'd run back over, he'd lock it over and over again, probably 30 times at least in the space of this hour. And it was just interesting watching her interact with him, because she was hitting on all the things that I knew and that Shan knew from all of our testing, or all of our experience, and just watching it over and over again. It was like validation for me. It was very exciting to have something to put on it when we were getting the testing. It's one thing to know that something is there and something that's, but to have something that you know what it is, so you can begin looking at treatment options. That was really important for us, because we've had a lot of medical struggles in our lives, and very few of them have had labels that we can say this is how we're going to proceed. And so
with Lily, I was the one that went in with Lily, and the way that she shows her autism and things she does are completely different from what Jarrett does. But going into her testing, she is super shy, and she had a hard time doing what was being asked, just because she was shy and didn't necessarily want to do it. And so I think one of the things there that I learned from this is, even if the person that's doing the testing isn't seeing everything that we as parents see, they're still going to be able to see some of the things that are going to get that autism diagnosis. So I know that when we got our results, I was surprised with some of the stuff they said, because they were like, well, she wouldn't talk to us during the testing. She wouldn't really engage. And I told them, I'm like, she has a huge vocabulary. Is that going to change the level of her diagnosis? And they said no, because she wouldn't do it with us. That still is one of those markers that we're looking for. So, I think one of the things that parents need to think about going into this testing is, the person doing the testing doesn't need to see every little thing. They do know what they're looking at, kind of how Jeff was saying with Jareth. They started picking up on some of his little quirks that he has and tailored some of the testing to that. So, just go in there and have faith that they know what they're doing. They've gone through this.
That was so much great information from Dr. Womack. My takeaways are this. Autism evaluations will vary among different facilities, so don't be afraid to ask questions, and don't be afraid if it looks a little bit different than someone else who has gone through the autism evaluation process. It's okay. Everybody does it a little bit differently, and a lot of times it's because of the needs of the person who's being evaluated. Generally, the first step is a questionnaire that you'll need to fill out beforehand, or maybe at times during the evaluation. But the questionnaire is really just a launching point. The evaluation really attempts to look at the person globally. So it's not just the questionnaire. It's not just the day of the evaluation. It's all of the information together that gives us the valuable information that comes out of an autism evaluation. The person or person's caregivers who's getting evaluated, they're likely to be interviewed before the formal evaluation as well, and that will kind of clear up any questions that the evaluator has on the questionnaires typically, and maybe bring some new things to light that the evaluator can look for when they're doing the formal in-person evaluation. I enjoyed Dr. Womack. If you have questions for her, send them over to us at autismnavigationpod@outlook.com.